Hi guys, how's it going? This seems a little odd for me, but nonetheless, I'm glad that we're going to review the chemistry module even though I'm absent. At least it gives you something throughout the week to do so that you're so much more prepared for next week and that you continue the learning. I'll be using the PowerPoint, the chemistry profile PowerPoint throughout. That tends to go hand in hand with the packet. Please have the packet available along with the PowerPoint, and that'll help you. I'll try to remind you a couple of times that at the end of this module, in your lecture packet, there is a chemistry profile worksheet, and that will be due next week. I know it's not in your syllabus, but I wanted to give you something to reflect on after you watch this video. Anyways, I hope you don't miss me too much. And let's get started. This is the chemistry module, and ultimately when we talk of blood chemistries, we are taking obviously a blood sample and we are running it through these specialized machines, and these tests that the doctor orders, we will look at different enzymes or different things that the body produces, and many of these enzymes, hormones, whatever, correlate to a different organ or to specific things like just generalized metabolism. And I will introduce those to you. And what an excellent source of information once you understand which enzymes correlate to which organ or which system. You, the vet tech, can play an integral role in the process of diagnosing problems in animals. Here's a visual of one of many chemistry profiles. Ultimately, this is a machine that is going to generate these results. So it's important for us to know how to perform these tests or use these machines, and they will give you all of the enzymes or the things we are going to talk about. It gives you the result of the animal, and then it tells you a normal range. So here's the low normal and here's the high normal, and what a nice little visual, especially in color. You can say green, good, red, maybe not so good. Here's another visual. Here's actually the chem profile down here. Here are all these little enzymes, the normal range, the animal's result, the normal range, and a visual aid for you. Again, here's another one. Different computers are going to generate different printouts, but nonetheless they offer the same format of information. Now, you're going to refer to these tests, or you're going to hear people refer to them as profiles, blood chemistries, serum chemistries. And even though the first generation of machinery to perform these tests all required serum, the new machineries will also allow you to use heparinized blood. So this is a great opportunity for us to review our vacutainers. And if you're not familiar with those vacutainers, let's go back to VLP, and there's a wonderful little chart. Serum. What is serum? Well, we know that serum is the liquid portion of clotted blood. So if we take a blood sample from the animal, we stick it in a particular tube that we want the blood to clot. Then we spin it down in the centrifuge, separating the cells from the liquid. That liquid is serum. Hopefully you said to yourself, I need a red top tube or a marble top tube to perform this test. New generation machinery will also allow you to use heparinized blood. And so heparin is an anticoagulant, will prevent the blood from clotting when mixed with the blood. And heparinized blood is a green top tube. Why would you perform these tests? Now, we can even maybe look at your personal life and ask ourselves if you've ever had to go in for anesthesia, for a surgical procedure or some sort of procedure. Your medical doctor asked you to go to the lab to have some blood drawn beforehand. And most likely this is one of the tests that they asked for, a chemistry profile. So many times we will want to do blood work before any anesthetic situation. Now let's think about this. Many of these enzymes on the profile correlate to different organs. Maybe an organ, let's take for example the liver. What if I was anesthetizing your dog and your dog had some liver issues? We would be able to see that in a chemistry profile. If I knew that beforehand, me being the vet tech, I would choose an anesthetic drug that wasn't metabolized through the liver, or maybe just slightly through the liver. Maybe I would choose an anesthetic drug that was more metabolized through the kidney. Because if I used an anesthetic drug that was primarily metabolized through the liver and your animal had liver issues, we could make that worse. We're trying to prevent things like that from happening. So we use it to detect issues correlating to those organs. Now, of course, I'm going to talk about Phoebe. When Phoebe was brand spanking new, I got her at 8 weeks of age, and a few weeks after, I drew a blood sample and ran a blood chemistry profile because I wanted to assume that she was quote-unquote healthy, that there were no organ issues, but if there were, it would have been able to pick it up, hopefully. But I wanted what was called a baseline information. And thankfully, the blood results came back within normal limits. And but many weeks after that, she came down with a bout of vomiting and diarrhea. So Dr. Wagner, after our physical exam, decided let's draw blood for a chemistry profile. We looked at those results and compared it to our baseline from weeks before that. So that was a wonderful diagnostic tool. So as I've mentioned, I've used it as a general screening process, giving us some baseline information to confirm or rule out a specific disease. If you're suspicious of an organ disease, if you have an animal that you are suspecting kidney disease or liver disease or pancreatic disease, you can use this to help you rule this out or to confirm it, to say yes, the animal does. Now let's say an animal did have liver disease or some sort of liver issues, and the doctor has prescribed some therapy. We could then recheck this chemistry profile weeks later, days later, whenever, to see if our therapy is working. And if it is working, great, we can continue on with that therapy. If it's not working, then it gives the opportunity to the veterinarian an opportunity to reevaluate their therapy. Usually a general workup for a pet will include a chemistry profile, what we call a CBC, which looks at red blood cells, white blood cells, and platelets. You're going to take a class hematology that is going to focus on you perfecting a CBC. And then VLP, think back to that class when you did a complete thorough urinalysis. So those three tests generally revolve around a workup on an animal. Now, a profile, as I mentioned, a group of tests appropriate for a species. So you can see here it says canine greater than 8 years of age, and so it's very specific. I don't even have any cats here. This is a dog one. The normal ranges for the different species will be different. And so these computers will ask you what sort of species you're dealing with: cat, dog, ferret, whatever. Chemistries are typically done on serum. You can be guaranteed that all of the machinery will require serum, but again, like the newer generation machines, like we have down in our clinic, we actually have this machine in one of the parasite rooms, 1086. And this is a great machine. It's a little bit of an older technology, but still very reliable. It always requires serum. New generation like this one and the one in our clinic will also allow you to use heparinized blood. And how convenient is that? Because you can take it right from the animal, the blood sample, put it in a green top tube, and immediately put it in this machine, not wasting any time. This particular machine, you gotta wait for the blood to clot, then spin it down, and then put your serum into this machine. So the heparinized blood certainly gives us an opportunity to be a little bit more efficient, especially with our emergency patients. When you are drawing blood from an animal, and let's say you are needing serum, what a nice opportunity for you to also evaluate the serum or plasma depending on what sort of sample you're drawing. This is a review from VLP in that after you spin it, you look at this liquid, and if it's clear, like water, or if it's this light straw color, very, very light tan, then you can assume that's normal. Clear would be, if I just drank a gallon of water and you then drew a blood sample, you would expect it to be very clear because I've diluted it with a lot of fluid. So it's got to correlate to the patient. If the serum or the plasma is very yellow to orange, that tells you that there's bilirubin in it. Bilirubin is something that's processed through the liver. And hence, you can say if it's very icteric, this yellow-orange color, you can assume that there are some issues in the liver. You can't tell at that time what is wrong with the liver, but you can say, we have to look at the liver a little bit more in depth. So here's an icteric patient. If you had an icteric serum sample, I bet you it's going to correlate to a very jaundiced patient. Or it could. If the sample is hemolyzed, okay, right here is packed cell volume, or a hematocrit. And I hope you remember doing this from VLP, where you put it in this little blood tube, you put clay on the end, you spun it in this special centrifuge, and it separated the cells, red blood cells here, there's some white blood cells and some platelets right in what the area called the buffy coat, and then you have the liquid portion, serum or plasma, depending on what sort of hematocrit you're using. Again, this particular one looks very normal, it's clear to white, and you should always assess packed cell volume behind a white sheet of paper, because then it'll be true color. This particular hematocrit to the left of this one, the sample looks very pink to red, and that tells you that it's hemolyzed. Now, a lot of reasons for a hemolyzed blood sample. Let's say you went into the patient with your needle and you start fishing around. Makes me crazy. That could cause the red blood cells to burst, and hence releasing that hemoglobin into the fluid. So it could be technical error. What if you drew the blood sample and it was beautiful right into the vein and you pulled back the plunger very aggressively? That could lead to a hemolyzed blood sample. What if you did everything correctly with your venipuncture but threw it into your vacutainer very aggressively, pushed the blood in? That's going to lead to hemolysis. So usually, for the most part, a hemolyzed blood sample is due to technical error. We messed up. But it can also be due to disease. Think back to week 1 when we met, when we talked about immune-mediated hemolytic anemia. Hemolytic anemia. So you would expect the sample to be like that. All right. If the sample is very lipemic, looks very cloudy, milky, that tells you that there's a lot of fat in the blood. Lipemia, liposuction, suction out fat. It says there's a lot of fat in the blood. Now, it could be because you have a really fat patient, voluptuous patient, or the patient might have just recently ingested a lot of food. I just had a big smoothie, and so if you drew a blood sample for me right now, I wouldn't be surprised if it was slightly lipemic. Now, I have to take off my sweatshirt, so time out. I get all worked up. All right, so if you are administering any drugs to a patient and the doctor has ordered some blood tests, you want to draw the blood before you give any medications, because the medications can alter these chemistry results in an ideal world. Now, if you're unable to do that, when you're getting a history from a patient, actually the client, you want to ask what drugs the patient is on and when they administered that last, whenever they administered their last pill or liquid. Ideally, especially for these highly voluptuous patients, you'd want to fast the patient because, again, the food that we take in can alter our results as well. I just went in for my annual physical exam and they wanted to do some blood tests, but I had already had a cup of coffee with some cream in the morning. And so my nurse practitioner chose to not draw the blood, knowing that the cream in the coffee was going to cause probably an increase to some of these enzymes, especially things like cholesterol. We should know before we draw blood what tests the veterinarian has ordered, because we want to get it all done in one-stop shopping, so to speak. You wouldn't want to be poked with a needle and then the nurse come back and say, oh, you know what, the doctor actually ordered another test. I need to poke you again. So before we do any sort of venipuncture, let's figure out what tests need to be done, because that's going to help guide us to what sort of vacutainers we need to collect our samples in and how much blood we need to collect. Now, 2 rules of blood collection are these. If you were to draw 3 mils of blood, just suck out 3 mils of blood from a patient, you can, in a healthy patient, assume that 3 mils is going to give you 1 mil of serum or 1 mil of plasma. Many tests require serum or plasma. Plasma meaning the other tests independent of chemistry profiles. So if the test requires 1 mil of serum, you know that you need to collect 3 mils of blood. Here comes the second rule of blood collection. Draw enough for 2 tests. What if you were performing this chemistry profile and this chemistry profile requires 1 mil of serum and then the electricity went out? If you only collected 3 mils of blood, you then need to repoke the animal to get more blood. But if you did perform the second rule of blood collection, collecting enough for 2 tests, you won't need to do that. This is great practice as long as the patient isn't anemic. If they don't have a lot of blood to give you, then don't do this. Place the blood in the appropriate tube. So depending on what test or tests the doctor has ordered, we've chosen the vacutainers. If we're collecting serum, we know we transfer the blood into the vacutainer. Need to let it clot. That might take 5-10 minutes. And then spin it down so that you can harvest or remove the serum. If we need whole blood, then we just transfer the blood into the vacutainer, gently inverting, of course not shaking, gently inverting so that we mix the blood with the anticoagulant to prevent the blood from clotting. And then we can perform our tests. If we specifically need plasma, then after transferring the blood and inverting the vacutainer, we then can put it immediately in the centrifuge to spin it down so that the cells and the liquid separate. We can refrigerate whole blood, we can refrigerate serum, we can refrigerate plasma. We cannot freeze whole blood, but we can freeze serum or plasma and keep it for many, many, many months. Many of our tests that the doctor orders can be done in-house, depending on what sort of machinery you have. If you do not have these pieces of equipment, then you have to send it out. And these are referred to as reference labs, so outside labs. They will have requisition forms for each test. So you have to fill out the forms accurately and neatly so that they can read it. I know, don't laugh at me, I know I can scribble, but when it comes to these requisition forms, I'm very neat so that it's very legible. And then we want to package them and ship them. So think of these vacutainers, they're glass tubes usually, so therefore let's bubble wrap them to prevent them, they will bang around in transit, so let's prevent them from breaking. Because if they break, then we got to start all over again, and that's a waste of time and also a poke for the animal. Here are again some of the machines that I've already pointed out, very commonplace, especially with your general practitioners now. In VLP, you saw some strips, the dipsticks that were specific for urine, and the different things like protein that was examined on urine, like white blood cells, or urobilinogen, or bilirubin. I think there were 10 different things on the urine strips. We also have strips for some of the enzymes that are specific to the big profiles. They're great if we need information right away. We dip the blood in and then on one of those impregnated pads, and then we look for a color change. No different than what you did with the urine strip. They're fast. We get our answers. They're inexpensive. You don't need any specialized equipment, some $30,000 machine, but it's not very specific. So it's less accurate than the machines, but at least it gives you an idea of some of the enzymes. If you take other classes, some veterinary elective classes like emergency critical care, you'll work with some other miscellaneous machinery like the iStat or a blood gas machine. These are very specific to emergency patients typically. So let's get going with our specific enzymes. I'm going to print out one of these forms and give it to you actually tonight so that you can kind of train yourself and learn these acronyms and which organ they correlate with. I'm just going to go off the top of my head. Alkaline phosphatase, primarily a liver enzyme. ALT, alanine transferase, primarily a liver enzyme. This is actually a better enzyme, more specific than alkaline phosphatase. Amylase, you know this from comparative anatomy. Amylase was made in the pancreas. So this is a pancreatic enzyme. Blood urea nitrogen, urea, this is a kidney enzyme. Calcium, calcium makes our bones nice and strong. So this isn't specific to an organ, but more so just general cellular metabolism. But we can talk later about this common mineral or electrolyte and its function in the blood, not our bones. We know what it does in our bones and our teeth, makes them nice and strong. Cholesterol, very general to the body. We certainly know cholesterol. What do you think of when you have high cholesterol? You might think of a patient that is overweight or maybe not on the best nutrition program. Creatinine, this is a very good kidney enzyme. Please don't get confused with creatine. Creatine is something that you may have heard that's specific to muscles. If you see those guys or girls at GNC, maybe one of those stores where you buy vitamins and minerals, and they might buy creatine, those muscle builders, muscle workouter things, whatever their people are called, and they take creatine to make their muscles bigger. This is creatinine, specific to the kidneys. Glucose, think of glucose, general basic sugar. This is specific to all cells in the body, not specific to an organ. This is cellular food. Phosphorus, you might remember it from VLP and its importance to the kidney. Total bilirubin, this is specific to the liver. And total protein, we need protein in our health for general cellular metabolism to feed our cells. That'll be very specific for the different species. Cats need more protein than dogs. This is just a very basic profile. There are other profiles that are more involved. These are many of the enzymes that we're going to talk about today. All right, let's first talk about liver disease. You can go through this particular site, kind of reviews some basic things that the liver does. It is so important, the liver. You need your liver for 1,500 plus different functions for the body. It's essential for survival. You can donate a piece of your liver, but you can't donate the whole liver to somebody who needs it. But this is a very important organ. So here are some of the basic things that it does. So in a healthy liver, it stores glucose. So I just had, as I mentioned, a big smoothie. As the hours go by and my cells become hungry, they can say, hey liver, give me some of that glucose that you stored. So it's a nice warehouse for glucose, keeping it there until the body needs it, releasing it when the body needs it. The liver produces a protein called albumin. Albumin, again, is a protein that is very integral for the blood. And so if we think if the liver is not healthy, it is not going to produce this blood protein. Hence, we could see some some issues with our blood. So kind of think of the flip side. If it can't be a warehouse, then it's not going to release glucose when your body needs it, or even store it. Processes bilirubin. We'll mention this. Bilirubin is what gives you that yellow appearance in the serum or plasma, or gives you that jaundice. The liver is a wonderful recycling plant, and it will process bilirubin, which is very helpful for blood. And if it can't process bilirubin, then we're going to have that leakage of that bilirubin in the blood. Bile acids. Bile. Think back to comparative anatomy. The liver manufactured bile, not bile acids, it manufactured bile, stored it in the gallbladder, and then released it into the intestinal tract, helpful for digestion. Bile acids are something similar but different that are important for gastrointestinal digestion. And if we can't recycle this then their recycling plant shuts down. So think of if you put recycling out for the garbage people to pick up. If the recycling plant is not working or backing up, then we're not going to be able to recycle, and all the garbage at the end of your driveway gets more and more and more. So again, these are 4 things that the liver does. There's 1,500 things that the liver actually does. Think of if I'm going to have a glass of vodka, I'm going to rely, well, I don't have a glass of vodka, my gosh. But anyways, but if I did, I would hope that my liver can detoxify my blood so that that alcohol doesn't stay in my blood for a long period of time. I'd be drunk all the time. You probably think I am, but I'm not. Anyways, many, many, many things that the liver does. Now, on these chem profiles, there are going to be specific enzymes that correlate to the liver. So it's going to tell you that these enzymes are high or are low, but it doesn't tell you the cause. It just tells you that there's a problem in the liver. It doesn't tell you if it's infectious. Try and think of something infectious. I'll come back later on. It can be a neoplasia. Maybe there's a cancerous mass in the liver. What if the animal just ingested a toxin and this toxin caused damage to the liver? What if the animal had a traumatic event, maybe got hit by a car right in the abdomen and caused some trauma to the liver? Degenerative. You know, you're a lot younger than I am. I probably have some of my liver cells, hepatic cells, that have died. So the liver over time, just like all facets of the body, all parts of the body, we have degenerative conditions. Congenital, maybe somebody or an animal was born with a dysfunctional liver or a part of the liver. Inflammatory, things that cause inflammation. Well, that can be so many different things. But remember, the second line of defense with the immune system was inflammation. Drugs can cause inflammation. Drugs is another example of non-infectious reasons that can cause liver disease. Infectious, I hope you thought of infectious hepatitis like CAV, canine adenovirus type 1. There are so many different things, but again, this test is not going to specifically say, it's liver cancer. No, it's going to tell you there's a problem here. Look further. Do some other tests. So, when you have liver disease, or when you have kidney disease, there's a difference between organ disease and organ failure. Organ disease, you can live with liver disease, kidney disease, pancreatic disease for many, many, many years, especially if it's a mild form. Liver failure, kidney failure, pancreatic failure tells you that statistically there's only 5 to 25% left of that tissue, of those cells remaining. And so it's certainly far more of a grave prognosis when things are failing compared